She is the Director of Gastroenterology, Hepatology and Liver Transplantation at the Institute of Digestive and uh, Science at Medanta, the MedCity. She's a pioneer in pediatric liver transplantation in India and is credited with several firsts in the field of pediatrics in India. Dr. Neelam Mohan has been awarded with the B.C. Roy Award and the Vashisht Chikitsa Ratan Award. Joining her on stage is Ms. Deepthi Sachdeva, the Senior Editor, Republic Media Network. Thank you so much.
We can definitely give her a huge round of applause, please. I know it's just the last session before lunch. A lot of you are restless, but she's been in the audience, waiting to speak. So I think they've all taken out a lot of their time, a lot of their patients are waiting, and that's the least that we can do. A good round of applause, please, for her. Now, we were just thinking, how can we get an audience that is really distracted right now, Dr. Mohan, that's waiting for lunch, They've been looking at a lot of jargons, a lot of figures.
Yeah, so the first thing to start with is, all of them are thinking that all the topics that we talked to you today, whether it was related to the cardiac, to the lung, to all, the seedling is laid in childhood. If you want to reduce the burden of diseases in adulthood, it is like saying कि सुई इधर गिरी है लेकिन इधर लाइट नहीं है तो चल हम उधर ढूंढते हैं. So that's what is the wrong thing to do, because the seedling is actually laid in childhood. So if you want to reduce the burden that you're talking of today, you want to reduce diabetes, you want to reduce heart disease, you want to reduce obesity, where do you need to work? Where do you need to look? It is actually the childhood. So now there is enough papers to show that there is a direct correlation between what you do in childhood and what is the repercussion at adulthood. And the second most important message I want to give is, what is that famous movie where he says, "Main aisa kyun hu?"
I'm the wrong person to discuss movies with. I just don't watch them at all.
Which movie is that?
Can't help you.
Lakshya. And who says that? So somebody has to give an award from Republic. So what is the actor's name? Hrithik Roshan. Very fond of him. I'm very fond of him. All the Khans and Hrithik Roshan. So he said, "Main aisa kyun hu?" And the answer is because of your microbiota. The microbiota in the body is 10 times more than your own cells of the body. So whatever you are today, it is because your behavior, your nature, is because your temperament, is because of your microbiota, and that is what the whole research and science is talking about, the microbiota. And if you want to understand the microbiota, you have to understand nutrition.
Yes, and before I allow her to push that point a little further, I want to check how many are parents here in the audience. How many are parents?
Great.
Are people thinking and then raising their hands? I'm a little worried. How many are parents here? Once more, please.
Almost all.
Okay. So what she'll say actually is more for the parents. And why are these parents culpable today, Dr. Mohan?
So actually, the truth is that 50% there is chance of obesity in adult if we were obese at 5 years of age. So isn't it sad that your parents, besides giving you the genes, so we parents, we learn everything. I want to learn cooking, I want to learn baking, I want to learn Microsoft, I want to learn computer. Did any of you say, I want to learn parenting? Why? It is assumed that बच्चा पैदा हो गया तो parenting तो आ ही जाएगी, which is absolutely wrong. I find it so astonishing when I see young parents who come to me. And yesterday I was doing sort of, July is going to be an ORS day. So I was talking a mother, they went for a holiday to abroad and the child was brought in a very sick condition, severe dehydration. so severe that it was unable to imagine that his pulses were not palpable. And I was asking her, did you give ORS? So basic things like ORS, how to give ORS, highly educated parents, they were not aware of. They thought ki namak chini ka ghol dena. So somewhere down the line, it is very important to buy a book on parenting and understand what are the four phases of parenting besides talking about, authoritative, neglecting. There are four types of parenting which we talk about. But my purpose today is to tell you that it is important to understand what is the right feeding to be done to a child. And while in India we were talking about, all the time about undernutrition and stunting and all, suddenly the 2018 report, the global report by WHO and UNICEF tells us that India is the dash dash Indian. What is that? Thin, fat Indian. So we are thin and yet have a pot belly. So the thick, fat Indian is the one who's predisposed to, you know, probably somewhere in our genes, we were learning to save in our body. So when our genes were learning to save in our body, we Indians put all the saving in our liver, etc. So that's why the pot-bellied Indian, you may be thin, but you'll have a paunch. So that is giving rise to all diseases, whether diabetes, heart, and all that. So we need to work, and 80% chance if a child is obese at 14 years and has one parent obese, he is going to be an obese adult. So all of you need to work right from the childhood in understanding what is the right nutrition, what is the healthy eating habits, what is the right lifestyle, because the non-communicable diseases, which is obesity, diabetes, heart disease, which are there, are all getting the seeds from childhood. Anemia is so high that and if any one woman wants to ask me that I want to increase the IQ of my child, the answer is if she ensures that the child is not anemic, you can increase the IQ by 10. So we Indians have been blessed by having very high skill rate. The doctors all over the world, famous India because our IQ is very high, whether it is coming to, technology and medical. So we do. So our IQ is so high. Imagine if we worked a little more, even those and IQ doesn't come from education, just in case. IQ is whether you're educated or not, it's your ability to understand and decipher. So looking into these things, giving the right nutrition, the micronutrients, the vitamin A and all, we are shying away from eating right when it says the food platter, the pyramid. The bottom has to be the vegetables, the fruit, and the whole grains. Say no to processed food. Be a good role model first before you expect from your children. So processed food is a big no. Sugar is a big no. I remember feeding my first son, like so many things with sugar. But now if all young mothers, when you go to a doctor, you read, it's zero sugar till 1 year of age. We are not giving sugars and salt because it is so easy to develop a taste to sugar. And did you know when we talk about obesity, fatty liver, which is more harmful, the fat or the sugar? The truth is the sugar. I heard the cardiologist talking about the fat and the lipid. While they are talking about that, the most of the newer data suggest that obesity is secondary to sugars. So you have to learn to get away from that sugar, the sugary drink, the unwanted calories, the juices, the Tetra Pak. These are the things which are harming our population. And if you want to work in adults, time to work in children.
Okay, I think this is quite interesting because what Dr. Mohan has done is given us a general overview of why parents are equally uh, right now responsible for how they raise their children. And if you raise your children well, especially at the formative ages, you are able to counter cardiac issues, maybe arthritis much later, and a lot of other things. But, Dr. Mohan, you mentioned a concept called the thin fat India. Is there also a divide of the north versus the south India? Because, I think all in the northern belt, you will realize that obesity is a reality and obesity is normalized. ये
Exactly.
तो healthy है, अच्छे खाते पीते घर से आता है. I mean,
Right.
those are the kind of things that even parents say. And a
Right.
lot of times they will think that, okay, this probiotic dahi is good, so let him eat the entire volume, pura tub kha lo. So, is it important? I mean, can we make these little corrections to be able to say that, if you fix this thing right away, you might not need to see the doctor anyways?
Yeah. So, two comments about that. One is, I think life teaches us moderation. That is the key thing in life, moderation. Whatever we do is required in moderation. So that is why the fundamental habits actually come in childhood. If you have a tendency to overeat, to do, it has been that's been inculcated in you as a child. So when you feed a child at that time, whether a child and adolescent, earlier 5 years we are saying that it is the family. So that's why I said 50% is there. Then I said 80% by age 14. So at that time what happens, it is the family and the environment. Environment is your advertising, sedentary lifestyle, snacking. While a child is doing all the time, he's seeing ads which are talking about, the various snacks, the juices, drinks, and working at school level. So when we need to bring this change in the country, we need to work we need to empower the parents and empower the school. These are the two. After that, we need the help of the media. It is media who can bring a change, because we need to do sort of some workshops, whether while I've been blessed because I've been the national convener for nutrition for the entire country, and national coordinator for nutrition, because though at the zenith I work at liver transplant, but the hardcore field where I want to bring an impact in the country in the nutrition in children is going to be through nutrition. So through the IAP, I've been working a lot in getting, and in fact, there was a consensus which came where I invited all people from South Asia, from Bangladesh, Nepal, Sri Lanka, and the neighboring Malaysia, etc. And we came out with the first of its kind consensus published in 2022, where we're talking about what would be the nutrition guidelines for children in India. We're different from the West. We didn't even have our own guidelines. We don't even know how much carbs to give. Did you even know we've been talking about a high protein diet, that if you give an infant more than 15% protein, he or she will become an obese adult. So it is important to understand these basic things and work in that, and do take out time to read onto that. And I think artificial intelligence is something we can all look forward to now, because through artificial intelligence, you all can have apps and ways of understanding how the artificial intelligence is going to make an impact in nutrition. What healthy eating. You want to eat something, just have an app, go feed on it, and see what is the amount you need to eat for it. So that is the way we are looking forward to bring about changes, because like there is a good, Kerala has got the highest diabetes. Did you know that it's the highest diabetes in the countries in Kerala? But Kerala is so highly educated, right? Magnesium deficiency is the lowest in Kerala. So it's a micronutrient deficiency. So the AI can tell us that what impact will a nutrition deficiency is going to have on the disease. What is its impact on your microbiota, and then going to have on the disease? So we all understand that whether it is diabetes and cardiac disease, obesity, all this, the microbiota is also working with us and giving rise to. So the newer generation, the new work is being done on nutrition, microbiota, and understanding what deficiencies are giving rise to the diseases.
Because you're an old school doctor, I say this because I have seen you, I watched you, and you've seen that generation versus today's generation that is very instant. We are looking for instant solutions. If you don't know something, quickly Google it, make a call, and there is a lot of
Chat
self-medication.
GPT.
Yes, and perhaps just pop a pill or something, and do the same when it comes to children. Now, there has been a lot of debate and conversation in the country about excessive medication. um, Also a lot of diseases that now are not being treated because you get antibiotic resistance. Now, when it comes to children, does that change? What are the precautions that, as parents, a lot of our audience and those watching you need to keep in mind, before going in for self-medication, or, perhaps just trusting their guts or what they've been doing traditionally forever?
Thank you, Dipti, for that incidental question because, and coincidentally, it's again related to non-communicable disease. Just to make myself clear, what is non-communicable diseases? Initially, we India were talking about infections, and that's like infective diseases we were trying to tackle. And while we worked on the vaccination, hygiene, etc., and combating with antibiotics, so we reduced this. And that's when the non-communicable diseases came. So non-communicable diseases, fatty liver disease, diabetes, anemia, nutritional issues, obesity. So these are the non-communicable diseases that we're talking about. And coincidentally, what she talked about, though was meant for treating infections, is actually having an impact on the non-communicable diseases because you'll be shocked to know that antibiotics destroy your gut flora. Once your gut flora is destroyed, there is huge chances of obesity. So one of the iatrogenic cause of obesity is use of antibiotics. And when children, we know when they are growing, they get 4 to 5 infections. That is, you're trying to get the immunity, your viral infections, etc. They need to go to an expert because all infections, you've all seen COVID, all infections are not bacterial. You don't need antibiotics for them. And you need, so taking wrong medication, OTC is a fad in India. Do you think that the person who's selling the medicine is more educated to talk about what to tell? Because I remember somebody, I wrote a prescription, and the next time that person came and he said, नहीं वो मैं जब खरीदने गया उसने बोला नहीं नहीं ये डोज डॉक्टर साहब ने गलत दे दी है, ये डोज नहीं देनी है, मैं आपको बोल रहा हूँ ये डोज देनी है. Can you believe that? And that person has the audacity to tell the the parent, and the parent is thinking डॉक्टर साहब ने गलत डोज लिख दी है, इसने मुझे बोला गलती से उसने लिख दी है, ये बच्चों में नहीं देते हैं. So how can that person be educated? How can you go over the counter and buy a medicine when it is, whether a child or an adult? In India, we have this sad way of, it's a good thing to save money, but saving money from health is a very unhealthy thing. Why? My son is now 20s, is gone for his education abroad, and he spends a lot of money on health. And me being a doctor, you know, every other day is on a dental just for a routine cleaning and checkup, $200. And I think like a typical Indian, like so much. But actually, he's right because he understands that if your dentition is not right, you get the bad bacteria, the microbiota, whatever I'm talking, into your system, and all these diseases are there. So that diabetes and everything now again we're understanding is related. So shying away and saving that money which you think need to be, taking a prescription and an advice is worthy than take a medicine. Tu ye kha le, tu ye kha le, tu ye kha le, tu ye kha le is wrong. It is very important because there is no medicine which is not without a side effect. The side effect could be as simple as a nausea or a bloating or a diarrhea or not to forget obesity. So these are, and to destroy your bacteria. And once your bacteria is destroyed, then you will get, I mean the healthy bacteria, you will get more diseases and the chain goes on.
And because you've touched the issue of money, so with your permission, I want to ask this question because, again, as a journalist, this is something that bothers me. In a country like India, where a lot of people cannot even manage their 2 square meals, children are malnourished. On the other side, you have in India, which is talking of obesity, of diabetes, and a lot of other things. Um, we clearly aren't spoiled for choices. The government has an Ayushman Bharat scheme in place. Uh, there is a lot of talk about insurance, then how the insurance companies flee you. What is it that we as consumers need to keep in mind? Because when you look at a hospital, you're like, yeah, this is a five-star hotel. A lot of these private hospitals have actually turned into these five-star hotels, clearly with a cost. When you go to the government sector, you realize you have to wait for months, perhaps to get operated, to get a basic test or a routine CBC. As a health provider yourself, as someone who's worked so much in this sector, and especially for children, what is it that parents today should be asking for? What should they be doing? And what is it the government should be doing?
Right. So first thing is when I want to recommend right from the basic, I want to say that number one, you as parents should understand the importance of growth monitoring. Growth monitoring is ensure that everybody has a growth chart because I was talking about whether it is undernutrition or overnutrition, whether you're in a primary healthcare center, a secondary or a tertiary healthcare center, government place or a private, there is something like a growth chart. That growth chart is extremely important for everybody, every parent to ask for it and have a chart and the parents to look because that's how you're going to look into monitoring the growth and nutrition of your child and ensuring the child is not overweight or underweight or obese or stunted, etc. Second, I would want to give that recommendation about the nutrition where everybody needs to understand what is healthy eating, understanding the importance of whole grains, vegetables and fruits. And okay, if you can't afford fruits for everybody, but at least the whole grains and that even in the rural health center, the processed food has gone so much into it that that needs to be, your Indian samosas and kachoris and all that stuff are also as bad as junk food as you're talking about that concept. And then coming to the question that you were raising, India has been struggling a lot, but the truth is this time the economic growth that India has seen has been phenomenal. We've seen extremely good economic growth and improvement in our illiteracy in the sense more literacy is going, poverty is reducing. While we are working and all that, these things came, we had to suffer the other end of it where we got used to unhealthy lifestyles and sitting and lack of sleep. And the previous speaker, Chitra, was talking about the young age group where people don't want to sleep till late. You're fighting with your biological rhythm, not understanding that actually half the diseases, when I talk about the non-communicable diseases, are related to stress. And did you know 70% of the adolescent population in India is suffering from mental health problems? You think sitting here, you people are educated and your kids, your sibling do not have, try to talk to them, take them out for 1 hour meal somewhere and see what their problems are. You'll be shocked that there is so much of stress and mental health issues which are giving rise to diseases itself, which we all can listen to Sister Shivani and understand how to take care of your emotions and that. So while you're talking about health, I think as a simple thing, when we talk about the primary and the secondary health, yes, the government facilities are doing very good. It's the tertiary care facilities and the quaternary care. Quaternary care that I work and I'm famous for is the liver transplant. So that's like a quaternary care. Working on a liver failure is like a tertiary care. So the government is now strengthening the government hospitals, and we've seen so many aims coming all over the country. So tertiary healthcare system is working. And one of the suggestions, if I may be allowed to give, is in the government sector, when I was a kid, my dad used to tell me about the Robin Hood story, and he told me, as a child, he wanted me to be a doctor, and he wanted me to get an award from the President of India, which I'm glad I lived up to his dream. And this third thing he used to always say was, take money from the rich, but please do good and free for the poor. That's what is there. So in that, what I want to say was that all of us as doctors should take the responsibility of doing some sort of, like I do charity for the thalassemics and all, trying to see them free because there's, so all of us owe that responsibility in looking at it. But having said that, a stitch in time saves nine. Always, everybody does to their best of capability, every doctor. But there is some knowledge which is available at a doctor at a particular level. And at that time, you need to realize that it is this time that need to go to a specialist to get the right advice. And being an advisor in Ayushman in the pediatric we were trying to formulate, I think I can foresee in the next decade a lot of changes. Post-COVID, the insurance company has boomed up with a significant rise, I think two-third rise, which they had never seen. So people are realizing the importance of getting themselves insured, and the government is looking for the lower category. But it's always trying to blame it on others. I want to blame it on media. You're not doing a god. So it is time that we all here should realize that health is something you owe to yourself. You are expecting government, you are expecting. Did you ever see what are you doing for yourself to be healthy? Are you looking into your way of eating right or sleeping right or your healthy habits? So all this non-communicable diseases which the government and everybody is spending on the insurance, isn't it your responsibility? So it is time to understand how responsible you need to be for your own health. And since I'm a pediatrician, there are only two things which you can do for your child. One is their health, and second is education. If you do the right health and education, you don't need to leave buildings in poverty. They'll be healthy enough to make for themselves a living being. So as parents, these are the two things we need to focus on, because you need to be a good role model. You expect the child to eat healthy, and the husband says, "Kya bakwas sabji banai hai?" So he understands कि अच्छा सब्जी तो बकवास है, कद्दू भी कोई खाने की चीज है, घिया कोई बनाता है, तुरई कोई बनाता है. So that's what as a role model he thinks ये सब तो गलत चीज है, पापा ने बोला था ये तो बकवास चीज है. So first be a good role model. If a woman wants to see a serial and then she expects, नहीं आपका screen time कम होना चाहिए. What is your screen time? What do you want to see? Saas bhi to kabhi bahu thi. Why can't you look into the other serial? So that's what I try to tell the parents and all that stuff, that I never allowed in my house when I was working, just two channels were there, where it was the news channel or the Discovery channel. So you also need to work, and that's why believe in quality. Less, you can't have more children, but quality, whether it is eating, whether it is taking care of children, you need to ensure quality that you need to give to your kids.
And Dr. Neelam, mind you, has a lot of interesting poll call anecdotes, but just because we're running out of time and, I'm getting indications that I need to wrap. But before I do that, the last question, because we
I
spoke
forgot to
about-
answer one more thing about the government. You were saying
Yes.
money. One of the
And you said,
things
the doctors, you can rob the rich, help the poor. I differ on that. I don't see doctors doing that.
No, no, I didn't mean rob the rich. That
You
was
can
not.
rob the rich, but
No, no.
if you are helping the poor, I think it's still
What I
justified.
meant was that 20% of your work you can do as charity, like online clinics and, people who need you. Like if I'm spending my time in empowering the country and coming out with protocols and teaching doctors, 50 weekends I'm like going and giving lectures on nutrition and diet, that means I'm spending that much of my time on healthcare. So what I wanted to say is the medical tourism. The government can look at medical tourism to make money for the health. Why I said that, now the next boom in India, we all know that health is the boom in India when it comes to growth, right? You are aware of that. And while you're aware of that, the next boom is actually medical tourism. India can be number one, I repeat, number one in medical tourism. People are going to Thailand and Bangkok, for whatever uh, uh, they. So when we talk right now, the medical tourism is 4 billion industry, 4 billion. 2 million people come to India, and we can go easily to 12 billion dollars in the next 3 4 years. And that comes not only from the doctors, not only the best of hospitals, the infrastructure, the skills, but the other industry which needs to get empowered. The mediator who's getting the, he is, may not be the healthy person. He wants his share, and is he doing the right thing? So the government has to make certain standardization, where to take whom. Like some standards have to be set, because if the media, the interpreter gets, so that sort of standardization, the guest house, because the person spends 20% of the time in the hospital, rest of the time he or she is going to the vegetable vendor, to go to the guest house. So all that needs to be strengthened by the government by some standardization, so that the healthcare.
You go down to a place in Uttar Pradesh, Madhya Pradesh, Punjab, you will see there are not even proper beds, leave aside any other facilities. But yes, see, this is a conversation that clearly cannot be contained in just the
In this,
next few minutes.
yes, there's a lot to
But
be done.
that is contradiction. I think when it comes to health in a country like India, as vast as India, where purchasing power of the poor, especially, a lot of them, like I said, I've seen people who waited for 6 months for a blood test because he can't afford to get a blood test in a private facility. But having said that, and I know we need to wrap, so just the last question that I wanted to ask you. Post COVID, you're looking at a lot of complications, particularly in adults. Life is fragile. You hear so and so has passed away because of a heart attack or any other thing. What about children? Children who've had COVID, do they need to be more careful? I think this is still an area that there hasn't been much research on, but with the kind of exposure that you've got.
During COVID, I remember giving almost 150 talks on the media, because every day I used to be literally full time working in children in COVID in Medanta and Haryana state. And uh, so I have seen a lot of health issues post COVID in terms of bad and good. The good thing is something has emerged in the parents that I meet. They realize the importance of health, and they've realized the importance of insurance. The percentage of people who are coming to me or insured or understanding the importance of health is higher than I used to see otherwise. So that's a good part about it. And the bad repercussions that I've seen is I've seen a huge increase in the functional health problems, what we call it as the psychosomatic issues, people coming to me with a pain abdomen and overweight and obesity, and all this have been related to tremendous psychiatric, even highly educated parents, doctors, their kids also I'm seeing, they have a lot of issues with depression, which is indirectly manifesting as pain abdomen and other issues. So this is something which parents need to understand, that you should, if your child wants to speak less, is on his own, is reserved, or doesn't open up, please take the help of an expert. It is time to understand those subtle signs in them, and need to approach an expert to understand those issues, because that's the change that I've seen in the children that I've been dealing with. There's been a surge of these problems subsequently. And we can go ahead talking so much, but some other time we have to take this discussion about health. But I want to just say one thing is one of my favorite quotes, is from Abdul Kalam. While while India was working in agriculture, wasn't he who looked at space? While there are doctors who do primary health care and work in there, don't you think you need to even applaud those doctors who are working at the tertiary care centers and trying to work in fields like liver failures, renal failures, transplants, etc.? The government never appreciates. For the last decade, feel that prejudice. If you introduce myself as a pioneer in liver transplant, and you will not even give an applause. But if I'm introduced as doing work in a state in Bihar, and you will applaud. So this is not fair. India needs both the wings to fly. You can't have one week just like a man and a woman. We wanted women empowerment to come too close to a man to raise. We need same. While you're working at the primary care and secondary care and improving, please be in time with the tertiary and the quaternary and improve your medical tourism, and that, because these are the two wings, keep both at pace to do. I'm not saying that the government should sponsor a transplant for 20 lakhs. Never. Never. They should sponsor that 20 lakhs for cure of malaria and tuberculosis, yes. But since healthcare in India is 70% private, 30% public, you have the right to your own healthcare. You want to spend your money for a private, or you want to get an insurance for that, yes, why not?
So what Dr. Mohan has done has given us a lot of food for thought, and I'm getting subtle and not so subtle indications that we need to wrap, because this is an audience waiting for the lunch break, and then we have speakers after the lunch. But it's been a fascinating conversation, and this really tells you, ladies and gentlemen, that there is a contradiction throughout the country.
Absolutely.
Private, public, what doctors think, what the government thinks, what we as consumers think.
Absolutely.
So I think this is where Republic Dialogue steps in, and this is our entire focus, to get people who matter to start a conversation, because earlier in the day we also had the Union Health Minister who gave us the inaugural address, and he made it very clear that health is a priority for this government. I don't recall any other government, the Prime Minister from the ramparts of the Red Fort had spoken about toilets for women. I haven't seen any government talking about toilets for women. We don't understand sitting here, that possibly is
Absolutely.
such a game changer.
I want to thank the organizers and Republic for this opportunity, because it's really, really nice for the Republic Dialogues to give this opportunity to me. Thank you so much for having me.
Thank you so much. Thank you, ma'am. It's an honor.
I am sorry, but ladies and gentlemen, due to the subtle delays, we are on a shortage of time and we will continue with the conclave. I thank you in advance for your cooperation. And moving on, we are going to take up our next session with the advancement of healthcare and technology, that India has gained massive achievement in knee replacement surgery. Now, these advancements aim to enhance surgical accuracy, improve implant longevity, minimize tissue trauma, reduce pain, facilitate faster recovery. To shed light on the healing bone of